Well, joining us once again tonight via Skype is the medical director of the Northeast Tennessee Regional Health Department, Dr. David Kershke. Thank you once again for joining us today.
Sure, happy to be here.
You have been such a great resource for us. It's now been about 3 weeks since Tennessee has kind of started this more aggressive testing statewide. The numbers here in Northeast Tennessee have continued to stay pretty low compared to other parts of the state. What do you think about this trend moving forward? Do you think we're going to stay on the low side of those numbers?
Well, I think we've gotten there through a lot of hard work, really, by everyone in the community in terms of social distancing and the stay-at-home orders and things like that. Now that that's lifting, we do expect those numbers to increase because, like you just said, told the numbers that are out there, we do have cases in our community. Also in Tennessee, there's a large number of cases throughout Tennessee, so there's always possibility of reintroduction of new cases from outside as people travel. So we do expect those numbers to go up. Really, it depends on how well people social distance while the economy is opening up.
Well, speaking of that, our gradual reopening of Tennessee is continuing with close contact business. We're talking like hair salons, barbershops, dental offices now reopening for, you know, those normal appointments. Any concern that this may play with the numbers a little bit?
Yeah, so it really, again, depends on how well, you know, these businesses comply with what the governor's recommended in terms of trying to be safe. So we're not going back to normal. So there are recommendations to help keep it safer. And I would recommend that the public also kind of monitor that and don't go in a place that doesn't not look like they're taking the governor's recommendations seriously.
Also, with this reopening, the University of Tennessee has announced they plan to have students return to campus this fall. What's your reaction to that move? Would it be time then, or do we know yet?
Yeah, I think it's too soon to tell where we're going to be on the curve, so we could be having another surge of cases. And again, it really depends on what the details are. So there will have to be, you know, continued social distancing put in place and other prevention measures. And it really, again, depends on where we are on the curve at that point, whether schools can safely open up.
There's still so many unknowns, and it's hard to predict down the line what's going to happen because of this. What about ETSU? Have you been in contact with them about students returning to campus there on the main campus?
Yeah, so we're not part of their decision-making process necessarily. I think that would be more at the state level. Mm-hmm. But we have had discussions with leadership from ETSU about what the current situation is in our area. And it seems like they're asking all the right questions and have the, you know, safety and health of students and staff, you know, at the top of their priority.
That's wonderful. That, I'm sure, puts a lot of minds at ease. Governor Lee also announced that some businesses would get those touchless thermometers from the state to help businesses and business owners implement all of these new safety and health guidelines. How big of a help do you think this is going to be for these businesses and business owners? Because I know a lot of them are spending a lot of money in order to follow all of these guidelines.
Yeah, so we do ask businesses to screen certainly their staff, but also potentially the public for symptoms and for fever. And the touchless thermometers adds a safer way that they can do that for the fever. We do, though, remind people that people can be asymptomatically infected, which they will not be picked up on the screen. So even though these measures are making us safer, we do still have to remember that everyone needs to be careful as they're out in public, because we do have asymptomatic cases in our region.
A big buzzword right now is antibody testing. Tell us, has it reached here? Is it going to? Are we closer to stepping up our efforts to do that antibody testing in this area?
Yeah, so we have seen a few results of antibody tests that doctors in the community are able to get. So antibody tests do have to be interpreted with care, so we're not exactly sure what they mean at this point, because there can be false positives with antibody tests. We don't know if a positive antibody test means that you have immunity or not yet. So we are interpreting them with with care. We do call it a probable case instead of a confirmed case. We do recommend people with positive antibody tests get tested with the PCR coronavirus test, which is what we're using in our health departments.
Boy, looking back, the first case in the United States was officially reported back in January. How has the testing and the treatment and how we're dealing with this progressed over the last few months?
Yeah, so you have to ask another expert about the treatment. But in terms of testing, we have way more capacity to test currently, and we feel like we can test everyone that needs to be tested currently, which is an advantage, especially as we open up and potentially get into a surge where we have more people that could be sick that need to be tested. So that will be important going forward, just the capacity to test, because one of the best tools we have in public health is identifying cases and getting them into isolation so they're not in the community spreading it, and then finding all their contacts and making sure they're staying home in quarantine. So if they get sick, they're not spreading it. So testing will be important going forward.
Dr. David Kirschke, the Medical Director of the Northeast Tennessee Regional Health Department, thank you so much again for joining us.
Thank you.